Are you noticing hair in your shower drain or on your comb? Seeing your hair part looking wider and feels like thinning? Hair loss can happen for a lot of different reasons. I'm Dr. Siba. Let's chat about hair loss in women and what might be going on. Let's talk about the most common type of hair loss, shedding. It can be sudden, a bit scary to find hair all over the place. But the good news is it's usually temporary, the sudden shedding. If you notice hair falling out in clumps, especially for a couple of months after things like a viral illness, childbirth, miscarriage, surgery, a crash dieting, or it could be because of thyroid problems or low iron, that's most likely telogen effluvium. Basically, your hair follicles are taking a break. They're not dying off. This usually sorts off within 6 to 12 months. If you notice a shedding about 2 to 3 months after a trigger, a doctor can do a hair pull test to check. The treatment usually focuses on addressing the underlying cause, like fixing the iron levels, thyroid issues, fixing the nutrition, or giving your body time to bounce back from the stress that has been going on. The second type is the thinning, which happens more gradually, but it can be a bit sneaky. If you're seeing your part getting wider and your crown looking a bit see-through, this is often called a female pattern hair loss. It's linked to genetics and hormones. While it's not something you can completely cure, it's definitely treatable. The best options include topical minoxidil, which has the strongest evidence, and sometimes low-dose oral minoxidil under a specialist care. So some women also benefit from anti-androgens like spironolactone. Starting the treatment early makes a big difference in that thinning of the hair, but you will need to keep at it for the long haul to maintain the results under the specialist. PRP is regarding the platelet use. It is used in female pattern hair loss with limited evidence, but it could benefit especially perimenopausal women when done appropriately in sterilized clinics. Round bald patches or eyebrow thinning often indicate alopecia areata, an autoimmune condition not caused by stress or shampoo. The treatment includes intralesional steroids, that is steroid injection into the small patches, and it can be done by the dermatologist or trichologist, and you need to see the specialist in case there are patches. I often get questions about supplements in menopausal women, particularly or middle-aged women, whether it is deficiencies that need to be fixed. Some well-supported options include iron, especially if the ferritin levels are below 30, vitamin D and zinc. Marine complex supplements like Viviscal, saw palmetto, they show promise, particularly for androgenetic alopecia. As for biotin, it's commonly promoted for hair loss, but there isn't much solid evidence to back it up. Plus, high doses of biotin can interfere with your thyroid lab tests, leading to false results. So you need to let your doctor know if you're taking biotin when you have blood tests. The red flags you shouldn't ignore in hair loss. If you see redness, burning, pain, or a scalp looks shiny with no visible pores, that could be a scarring alopecia, and this needs urgent specialist review because early treatment will prevent the permanent hair loss. So if your hair is shedding suddenly, thinning slowly, or patchy, that's non-urgent, but you need to speak to your GP or your family physician so they can investigate, treat, and support you. You're not alone, and when there is a hair loss, you're not imagining it. Always talk to your doctor if you have a hair loss and if you need any supplements or any medication or investigations. Hair loss can be linked to any of your illnesses as well. So it's wise to speak to your GP. Stay tuned.